Good evening. Get them to finish politicking over here, shaking hands and kissing babies. What is it? Kissing hands and shaking babies? You better not say that. Hey, good evening, Carrie. How are you? Trying to find this prayer request that I got. Welcome to week 9. Yeah, week 9 of death and dying. I did the first 4. Crystal did a great job on the second 4. Holly is with us tonight. Anybody want to guess what she's talking about? You all cheated. She's gonna share about what she does and what hospice is all about. She hopefully will dispel some of the myths about hospice. And so we'll turn it over to her in just a minute. Let me remind you that if you have a question or a comment, please raise your hand because we are videoing these sessions, and so we want to make sure your voice is heard both on the video as well as in this room. So we will bring a microphone your way and listen to your question or comment. So if you have a question or comment, just raise your hand, and we'll get to you as quick as you can.
Good afternoon, everybody.
Thank you. See how that worked? That was an illustration. She raised her hand, went there, and then she said that. Had a prayer request that came in by way of our Facebook page for someone named Amy Houtz, Houtz, Houtz. Amy Houtz. They've asked us to remember her in prayer. I think she's battling some cancer. We have a young lady with us tonight I met. I think her name is Sally. She's in the youth group tonight, Sally, and she's got lupus. She's going to Cincinnati tomorrow or the next day to have some surgery and start some chemo. So we'll remember Sally and Amy. Or those are the 2 I have. Prayer requests? Eric? Yes? Some people will say, well, we don't know what happened. We know what happened. Thank you for that. Stephanie or Stephanie? How do you say it? You have a special procedure coming up. Yeah. Yeah. Fun? Cincinnati's fun. I don't know about the trip. Okay. Amen. Remember Steve and Stephanie. Jordan. Crystal Vance. Austin Rucker. Let's pray for now. Injured or fatally injured? Fatally injured. Wow. 22. Remember the Rucker family. Bobby? All right. You know once I go over here, I don't come back this way, right? You know that. No. Prayer request? Lacey? Yikes. Yeah. Okay. Remember Lacey's friend Megan. You said that, and for some reason it clicked. Laura Keaton, which is Tracy Keaton is Teresa Brown's son-in-law. His mom, stage 4 at Cabell Huntington. I'm going to see her tomorrow. Same kind of situation. They're not real sure about her spiritual condition. And so we're going to go try to have that conversation tomorrow. So Laura Keaton, if you can remember her. Ray for Fred. Yay. Yay, bone shard. Angela. Okay. Mm-hmm. Remember Robert Allen. And in case you couldn't interpret what the baby was saying, it was "Pray for me, saints." That's, oh, yeah. Wow. Yeah. Those are tough ones. Dave Roach. Charlie, Bruce, Kevin, Brian. Got it. Locked in. I'll never forget ever. Who are you? Suzanne. All right. Kim? Cool. God is good. Okay. Yeah. Let's do that. Anybody that's been here then it hasn't been back for a while, that's depressing for them, I'm sure, because it's such a great place. And the cure is come back. Let's stand. Oh, I'm sorry, Lacey. Don't stand yet. Don't stand yet. Who knows how long this will be? I'm just kidding. I'm kidding. I'm kidding. Oh, yeah. Helen. Let's stand. Gary, it's too late. I've been to this side twice now. Please. Please. I'll take all you got. I'll take all you got. A lot of requests, but we serve a big God. Amen? Don't let me pray by myself. Lord, thank you for tonight. Thank you for allowing us to come into your house and to be together, Lord God, in our journey as we are discussing the transition from this life to the next. I pray that you'll just help us, Lord God, anoint Holly to speak to us, and just let us have open hearts and open minds to hear, Lord God, information that can be helpful for us. I pray tonight that as we stand on your word, that you would touch every need. God, there were so many. You said we have not because we ask not. So we're asking. We're asking you to intervene and intercede in every circumstance, in every situation, regardless of what it is, spiritual, physical, financial, emotional. We know that you're the God that's able to do all things. And so we present these needs to you and expect to hear testimonies and praise reports of how you have intervened. We thank you for the reports that we've heard tonight of how you've touched people and changed people and healed people. God, I pray tonight you'll just continue to guide and direct our church. I pray for every classroom, that every teacher would teach a life-changing lesson, every student have ears to hear what you want to say to them tonight. Help us in all that we do to bring glory to you. We thank you for that. Ask it all in Christ's name. Someone shout, amen. Turn around to 2 or 3 people, shake their hand, hug their neck, bump their knuckle, tweak their cheeks, bump their rump, do something, let them know you're glad to see them in church. Do you want to? You don't have to. Well, I can do it. Ray said she would. Let me make one request, that at the end of class, if we could stack these chairs up, just these 2 sections of chairs up, and move them to the other side of the portable wall. We're doing the blood drive Saturday at 9, and so it would just help them to have this area cleaned up. Here, listen, very special instruction. Listen, you can stack 3 chairs to drag. You cannot stack 4. If you stack 4, there will be train tracks wherever you drag them to, and I will find you, and I will kill you.
We still have 8 more slots left. So if you know anybody, if you yourself can't give, and I just got an email today saying that there is a severe shortage going on right now because of the sickness and from the holidays. People don't donate over the holidays in December, November, December, so they were already kind of down. And then with this wave of flu that's come through, their supply level is very low right now. So even if you can ask somebody, we have 8 slots left, and I just want to get all of our slots filled so we can have a good drive.
So after class, you stack them up by 3 and drag them over there, just anywhere on the other side of the portable wall. Get them out of the way, get them out of this area. If you get more than 3, you're either going to carry them, right? Or you're going to go over there and get the chair dolly. With the chair dolly, you can move 10 at a time. Everybody with me? Say, uh-huh. All right, and what are you going to do after class? I don't feel nearly as bad as I did before class started about my memory. For those of you that don't know, I can't imagine you don't, but this is my daughter, Holly. Her and Ryan are our youth pastors, as well as Holly does our children's church. She's the director of our children's church. Some of you hear me call her Mo, because we used to call her Holly Mo from Kokomo, but she's not from Kokomo. She's from Indianapolis. But Kokomo was a little city north of Indianapolis, so when she was little, I would call her little Holly Mo from Kokomo. And the Mo part stuck, and so I call her Mo, but you can call her Holly. She works at hospice, and I'm going to let her just tell you all about that and what she does and what they do. And if you have a question, raise your hand, and Carolyn or Vicky, I guess I'll do it. Ray said she'd do it. Go back and see Vicky. She'll show you how to work it. She'll show you. No, never mind. I'm glad you guys weren't looking. I'm glad you weren't looking when I did that.
Thank you. Wow. Okay, so I'm going to start off by saying I am terrified right now. I know, right? I am very used to teaching. I am very used to speaking in front of people, and I am very used to hospice. I am not used to putting both of those together. So this is very kind of out of my element, and I also know that a lot of people have a lot of judgments and ideas about hospice, and I'm just hoping that I will give you time to voice those, because I know that there's people here who have them. I just ask that you do it kindly, please. So I'm going to start by saying, who am I and why am I here? He already told you who I am. I started at hospice 7 years ago. This September, I will be going into my 8th year. I started as what they call a crisis nurse, and pretty much we would go in during the last hours of life, stay at someone's home with them, administer medication, give them baths, do everything we could to help the family. But crisis care is to be there pretty much during the last hours, very late. So I started doing that. Then I got moved to on-call, which pretty much means I was working the after hours. I was driving anywhere from here to Paintsville to Portsmouth, Grayson, Olive Hill, going everywhere and seeing patients after hours who were having a pain crisis or shortness of breath or, deaths, things that would happen. I was doing that for a while. And then I was asked to kind of head up the admissions office, which is where I am now. I'm the admissions coordinator for Community Hospice in Ashland, Kentucky. I've been doing this position for almost 3 years now. And pretty much it boils down to the fact that I'm the gatekeeper. If you get into hospice, it's because you go through me. And I get all the referrals, I talk to all the doctors, I talk to all the families, and so that's what I do on a daily basis. Why am I here? This beautiful woman is my why. This is my Mama Jo. For those of you who do not know, she was my mom's mom, and she was the best grandmother on earth. Like everyone thinks their grandmother was the best on earth, but she was the best grandmother on earth. She went from being the healthiest person I knew, doing many marathons in Indianapolis, eating like a rabbit, always healthy, never took more than a Tylenol and a thyroid pill, to stage 4 ovarian cancer like that. The prognosis was never great, even when they first found it. It had already spread everywhere. It was everywhere. They literally said there were thousands of nodules all over her abdomen. They went in, they took out everything they could, total hysterectomy, took out the gallbladder, tried to take off as many of those nodules that they could, and then after that, we're sitting in the hospital, and I remember me being there, my mom being there, and these two doctors walk in, and they immediately start talking about when she's going to start chemotherapy. And my grandmother, being the amazing woman that she was, had pretty much never put anything bad into her body. So the idea of chemotherapy to her was like a little crazy, because she's like, I've lived my entire life not poisoning my body, and you're telling me that I'm going to have to do that. And I remember her stopping them, and I remember her saying, I haven't decided that that's what I'm going to do yet. And so I think, if I remember correctly, and I could be off by a little bit, but if I remember correctly, their prognosis was if she took the chemo, it would give her anywhere from 6 months to a year. If she did not take it, we're looking at 6 months. There was a lot of discussion. She was very hesitant. I still, to this day, think it was something that she did not want to do. I think she made that decision based on some family members that kind of encouraged her to do it and fight the good fight. Her first round went very well. And she had a few weeks off before starting the second round, and she was doing good. She was able to do laundry. She was able to go up and down the stairs. She started eating again. And then her numbers were not good to start her second round, and she had to have had a scan of some sorts, and I don't remember exactly, because I just remember getting the phone call from my mom that said, it's back, and it's back like wildfire. It's everywhere. So she never actually got to do that second round of chemo. Then she decided to go under hospice care, and her wishes were to stay home and be around her family, surrounded by those that she loves. And that's what we did. She was able to do it on her terms. She was able to spend days out on the patio, which is what she loved to do. She was able to see her grandchildren. She was able to see her family, which was the most important thing to her. And hospice would come in and they would check on her, and they walked us through the stages of death, about what to expect, what was normal, what was abnormal, and what death looked like. Because nobody, unless you've been there, knows what death looks like. And after we came back home, that very next week, I quit my job and applied to hospice, and I was hired. Daily, I hear from people, I don't know how you do this job. I don't know how you do what you do. And my answer to them is always, I do this job because somebody did it for me and my family. And that is my passion, and that is my heart. My heart is to make sure that the transition between life and death is as smooth as possible, that a family is never surprised by what's going to happen, that they are comforted, that they are educated, and that the patient is as comfortable as we can possibly make them in order to do that. To me, and I know some of you will probably think this is very morbid, but to me, a death is just as important as a birth. Your entire life leads up into this one moment, these final moments. And unfortunately, for a lot of the family, that this is what they're going to remember, is how you passed. And my heart is to make sure that that happens in a good, positive way. And so I'm going to go out on a limb here, and I'm really nervous about this part. And I'm going to ask, what do you know about hospice? Do they have to be mic'd, every person? Okay.
So what I know about hospice was they are amazing. It's beautiful. It's calm, peaceful, and the experience I had was with my grandmother, and I know if my mother was here tonight, she would say the same thing, that it was, I don't want to say easy, but almost like what PT said, it was just being carried from one place to another, and it really felt that way, and I'm so appreciative of it.
Don't be shy.
Because I'm the mic holder, does that mean I can't speak?
You can speak.
Because hospice to me means all of those things and more, because when my mom was sick, when she left the hospital, they sent her to rehab, which was a nursing home near here that was very sad, very sad. And we didn't know anything about hospice, and after she was there for a few days, the doctor came to us and they said, have you considered hospice? And we was like, what is that? Come to find out, hospice is nearest to heaven. It really was, for my mom and for everyone in the family who was suffering too. So I wanted to say that.
Awesome. They don't have to be good things. They can be bad things too. I've heard them all. Oh my goodness. Everyone heard him, right?
Oh, he didn't have the mic. You weren't supposed to speak. Just kidding. I know a lot of people think hospice equals death. And that's what I thought of until my father-in-law had kidney cancer, and it was metastatic. And he lived 3 months after we found out. And I know that even Crystal talked about a lot of them pass away when everybody's gone. And so everybody had left, and it was, my mother-in-law and Steve's dad was there, of course, and me and him. And I told Steve, you need to say your goodbyes, because it was like 1 o'clock in the morning. Oh, I have a big mouth, really? Okay, is that better? Okay. So for us, hospice was there to make sure that the transition was as comfortable and as sweet as it could be. They had CDs of anything you wanted. They had fantastic food where you didn't have to leave the room.
Chicken and
I mean, they were fantastic. So for me, yeah, it is a great place, and I hate that people, you know, consider that also when they hear hospice, it's automatically death. This is great exercise.
I actually have a question.
Okay.
To me, every time somebody said hospice, I mean, that's what I think. Okay, they're near the end. It's the last days. I mean, that's how I put the two together. That's what I always think about hospice about. But how long do they stay? And I mean, do they have a certain? Is it the last days, or do they stay longer, or what?
Yes, I will answer that. I will answer that in just a second, because I am going to go over all of that. So I will definitely answer that question. You're going to find it somewhere else. Listen, be afraid.
Well, I know you just said you're going to answer that, and I'm not going to answer that. But when my grandmother and I talked to Crystal, and she was spot on when she said it was about a week, fell, hit her head, had a brain bleed. And so she was in the hospital 3 or 4 days, hadn't passed away yet, but still alive. So they put her up on the 6th floor, and they said, this is kind of like our hospice type area. And I was like, well, what does that mean? But that was just, they knew she was going to pass away. We just didn't know when. And I was like, I thought she was going to pass away that day. And then by the time you get to like the 4th and 5th and 6th day and they're still not passed away, you're starting to wonder, like, how long is this going to last? And I asked the nurse, and she said, we've had people up here up to 6 months. And I was like, really? And she said, yeah. So it was kind of a trying time when you don't know how long you're going to be there.
19 days. Pretty sure it was 19 days that my grandmother was not conscious, not eating, nothing. For 19 days, we went through that process.
You don't think life. It does. I'm sorry. It means death. Hospice equals death in your head. So negative or not, I mean, I have come to like the idea of death through this class, which sounds so morbid, but it's pretty cool.
I've learned a lot too.
My experience with hospice with my grandma, she decided to stay home. So me and my sister stayed there with them until when the nurses kept us in touch with what we were supposed to be doing. And meanwhile, my aunt was living with her, and she passed away.
Oh, wow.
So my grandmother slowly started coming out of it, and hospice was shocked because her kidneys and everything had just about shut down. Because we were just waiting. It was in days, and then my aunt passed away, and then all of a sudden my grandma came back to life.
Wow.
She lived 3 years later. So hospice isn't always death. My aunt was over-medicating.
Oh, boy.
As a side note, I went back and watched last week on YouTube, and it's kind of bad when you can't hear the questions. So the mic is definitely a good thing.
I'll stay on that for you.
The one thing I learned about hospice was with Christy Douglas, that to get her pain under control, she would go and stay at hospice, several days, a week, and I did not know that. That was totally, I just thought when you went to hospice, it was definitely the last days, the last week of life. But with Christy, it was going in, getting pain under control. And a friend of mine said that they would even, like with her father, offered for him to come and stay for a week to give the family some rest. And I thought, that's something you never hear about, because what you hear about is when you go to hospice, you're dying, it is your last days. Even though the process has begun, it doesn't mean you're not going to come out of there.
Right.
There's all those different reasons. I had no clue until Christy.
I had hospice in 1989 with my mom, so goes back a long ways. And then I had it in 2016 with my dad. So it was pretty cool. They were good.
Anybody else? Okay, so what is hospice care? Hospice care, and I like put together like 400 definitions because I was like, this is so hard to explain, but it's really not. I just want to make sure I can get it in this little paragraph. Hospice care is compassionate end-of-life care. Hospice focuses on symptom management and comfort for a better quality of life. Hospice teams of professionals and volunteers also address the emotional, social, and spiritual needs of the patient and the whole family. Hospice is designed to provide support not just to the patient, but to the family. That's what it's there for. They are there to support that loved one during the final stages of life, try their best to do what they want to do. If that means they want to go home, let them go home. If they don't want to pass at home and they want to go to I know most people are used to Huntington Hospice and they call theirs a hospice house. We call ours a care center. So if you hear me say care center, that's what I'm referring to. Want to go to the care center because they don't want to be home. We try and do everything we can to focus on their comfort and making sure that their wishes are carried out. While death is not an option for any of us, it's something we're all going to have to face, we do need to realize that we have choices when it comes to our end-of-life care. It's not something that will just, it might surprise you. I can't tell you how many stories I hear on a daily basis when I get referrals of, this gentleman was just having some stomach problems. He's been working, and his stomach just kept bothering him. He went to the ED, and the next thing you know, he's got stage 4 liver cancer, and it's everywhere, and there's nothing we can do about it. Every single day I hear these stories, every day. So it can surprise you. I have patients who are 104 years old, It can be one of those situations. But whatever it is, you have to be prepared as a patient, and the family also has to be prepared. And so that's kind of what we do. We prepare the patient what to expect. Sometimes we have patients that aren't really with it, we don't have to explain a lot to them. Sometimes we have patients, I got a referral on a 51-year-old the other day who was completely with it, still driving, still going to Walmart, still doing everything, but has cancer, chose not to do any treatment. And so she wants to know, what's going to happen? Tell me how this is going to happen. And so it's good to be educated, because as morbid as this sounds, and I know it does sound morbid, there are things that happen in the dying process that you might find abnormal, but are completely normal. How many of you have heard of the death rattle? Several of you. I think it's something that everybody's heard of. Does anybody know what that is? Besides Crystal? Go. Oh, microphone.
You're basically filling up with fluid and you can't get rid of it. That's the simple, easy terms.
So we all have secretions. Nobody even thinks about how often you swallow, right? Your body's shutting down, and all of a sudden you just stop swallowing. Where do you think those secretions go? Right. So all that is those secretions that aren't being swallowed going up and down over your vocal cords. To us, it sounds horrific. To them, it is not discomforting. Am I wrong? Okay. It's not. And we tell tell families that all the time. I know that sounds horrible, but it's harder for us to hear than it is actually something that's not uncomfortable for them. But there's things like that, like why do their feet turn colors, and why aren't they more conscious in talking to us? There's all kinds of things. People want to know this stuff. Like, they want to know what to expect, because if you're not educated on that and those things start to happen, you're going to panic and think, why is this happening? Yes.
Holly, can you tell me why the hospice nurse kept coming in and looking at Mom's knees?
Yes, I'll get to that.
Okay.
Okay, so
Sorry.
I'm going to answer your question about how long and who and all of that stuff. So who qualifies for hospice? In order to qualify for hospice, you need to have a prognosis of 6 months or less, and you're no longer seeking aggressive treatment for your disease process. Now, we all know that nobody knows when you're going to die, right? A doctor, I love it when I get phone calls and they're like, the doctor said we had 14 weeks. And I'm like, well, that is very specific. Like, wow. Like, that's a good doctor. We don't know. What this is saying is, you know, the doctor's saying if nature takes its course, the reality of you living longer than 6 months is very slim. Now, we've had patients who have been with us for a year. We've had patients who've been with us for a day. What happens with hospice, and I'll try and make this as simple as possible because it really boils down to insurances and different things like that. But you have a 60-day period that you're in hospice. If you make it past those 60 days, every 30 days you're reevaluated by a hospice physician. That hospice physician will come in. They're going to check your weight. They're going to see what you're eating. They're going to see if you've had changes in medications. They're going to see if you're getting better or getting worse. Because sometimes you will have patients who will get better, and you will have patients who will come into hospice and, they thought somebody, told them that they had 6 months or less, and they just start thriving. They just start getting better. And if that's the case, we love graduating people out of hospice. And you can always come back when you need to. I mean, that's never an issue. So what is aggressive? Aggressive is anything that is considered life-sustaining or curative. So, can a hospice patient have dialysis? I see some going and some going, no. Can't have dialysis, can't have chemotherapy. We do allow palliative radiation if they're radiating something to make it smaller so your pain will be less. We allow that. But pretty much anything other than that, we don't do a lot of nutrition. Now, that's a whole complicated situation, so I'm trying to think of how to say it. Like if you can't eat and you have a feeding tube. Like you can be fed through the feeding tube until your body is no longer tolerating that. Once your body is no longer tolerating it, we're not going to give it to you because it is more painful and distressing for your body to have to process that food than it is for you to not have it. So that's kind of where we are, because one of the big things, which I'm kind of getting ahead of myself, but one of the big things is will you feed them? I get asked that all the time. Will you feed them? Yes, if they can eat, we'll feed them. If it's going to cause them extreme distress, absolutely not. They're probably not going to want to be fed. The problem is, and I'm sure Crystal went over this, the problem is in this area, all you want to do is feed everybody. You come over, you want to feed them. You feel sad, you want to feed them. You feel happy, you want to feed them. Like you want to feed them. You want to feed mom. You want to feed dad. I have had people literally force feed, and it's just like, oh my goodness. And the person's just choking, and I'm like, stop. Anyways. So what hospice focuses on is comfort and symptoms. The best way to think about it is hospice does not treat your disease process. We're past that. They've told you that there's no more treatment. There's nothing that's going to make you better. So then you come to hospice. We're not treating your disease process. We're treating your symptoms. So if you've gone to the hospital and you've gotten blood transfusions every 2 weeks for the past year, We're not going to send you to the hospital to get blood transfusions every 2 weeks. When you start to show symptoms, if we feel like those blood transfusions are going to better your quality of life, absolutely we will do it. Same thing with fluids, IV fluids. If it's something we feel like is going to better your quality of life, we will do it. But if it's something that's going to cause you way more distress than it is, we're not going to. Those are things that are very hard to explain to people, and especially in this area. It's hard to explain to somebody that is dying of cancer why their mom doesn't need their thyroid pill that she's taken for 30 years. I know that may sound silly, but it's true. You're like, she doesn't need it, but she takes it every morning. She does not need it. I promise you she doesn't need it. And so it's hard to think about a dying patient when you're a living patient. When you're a living person, you think, if I don't eat every 4 to 5 hours, I get cranky, I get sick, I get tired. Well, you're also burning that. You're walking around, you're working, you're doing things. That person who's laying there, in the last days, they're not doing any of that. They're not burning it, they're not using it, and you're just putting more in their body for them to process, which is going to end up hurting them more than it is going to be helping. Here are some of the diseases that we have. Cancer, obviously, COPD, people who have COPD, that is considered a terminal illness. There's no cure for that. So if they're in the last stages of COPD, if they're wearing oxygen all the time, they're constantly having exacerbations of that, they would be considered to be hospice appropriate. CHF, congestive heart failure, ALS, Parkinson's disease, Alzheimer's, dementia, liver cirrhosis patients, renal disease, heart disease, just a whole lot more than just cancer patients. And I think that's why a lot of people maybe aren't educated on hospice, is because they are so used to it being the last step. And it's not necessarily the last step. Hospice should be the step before the last step, if that makes sense. It's because we do so much and we offer so much that people every day I hear people say, I wish I would have known about you guys sooner. I wish I would have known about this sooner. How many of you have heard of home health? Okay. They come in, they give you bed baths, they do physical therapy, they do all this stuff. How many of you would guess that hospice does all of those things as well? Did anybody know that you can have physical therapy while in hospice? Well, you can. You can't have unlimited physical therapy, but we will give you a certain amount of physical therapy if it's going to help your quality of life. Who pays for hospice? Medicare pays for hospice. There's a hospice benefit, pays for hospice 100%. Medicaid pays for hospice, and most private insurances also have a hospice benefit. Hospice is a non-for-profit organization, so that means regardless of your payment, regardless of if you have insurance, we are going to treat you no matter what. So, can't get it to go up. Oh no. What's included in hospice? This is what's included in hospice. Medications, equipment, your bed, bedside commode, shower chair, oxygen, nebulizer machine, BiPAP, CPAP. We include it all. You also get supplies, briefs, chucks for the bed, Bomex for the booty. Nobody laughed at that. For the booty. A chapped one. Oh, sorry. Bomex, lotions, just all kinds of stuff. You also have a hospice team. Your hospice team consists of not just a nurse. You have an RN case manager who will be a nurse who would visit you weekly. You have a social worker who makes sure everything's in place, wills, living wills, funeral home arrangements, all of that stuff. Power of attorney, everything. That's what our social workers do. We also have what we used to call them chaplains, but now we call them spiritual counselors, which they are optional. And most of the time we get, well, I have a pastor. We have a nurse's aide. We have volunteers. We have our medical director. Your doctor can also be involved in your care. We have bereavement counselors. We have respite, which is what, oh my goodness, Deb was talking about, where up to 5 days every benefit period, so 5 days out of every 30 days, your loved one can go to our care center and stay if you wanted to go on vacation for a few days, or if you just wanted to break, they would go to our care center and they can stay there for 5 days. And then we also have inpatient care, which is our care center, as most of you were to know it as a hospice house. The thing with a hospice house is a lot of people do know it as you go to the hospice house and you die. But what it is it's inpatient care. It is a situation in which your loved one can't stay home. Maybe they are having a pain crisis and we just can't get it under control with the medications in the house. Maybe they are coming straight out of the hospital and they have a new drain or a new feeding tube, and you need educated on how to take care of it. You would go to our care center, we would educate you, and then you would go home. If you needed medications adjusted, a lot of times during the end-of-life process, one of the rough things to deal with is restlessness and agitation. And so we would go to the care center, we would get your medications adjusted, and then we would send you home. Is it there for end-of-life care? Absolutely, but it's there for a lot of other things as well. So, yes. Oh, microphone.
What do the volunteers do?
Oh, the volunteers do lots of things. They really do all kinds of things. They can come and read. They can come and sit. They can come sing. They can just do, they just do a lot of things. A lot of times our volunteers are used in nursing homes because we have patients who are at home. We have patients who are in nursing homes. You can have hospice pretty much wherever you're at. And a lot of times we'll have volunteers go and sit with them during meals. A lot of times they'll go to the care center when the family needs to maybe go home and take a shower or run an errand. The volunteers will come and sit and make sure the patient's not alone. It's one of the biggest things that families want. It's not necessarily they want to be there when the patient takes their last breath. They just don't want their loved one taking their last breath alone. And we also have 11th hour volunteers, and they are usually there during the end of life, just to be there for the family.
I have a question.
Yes.
Is hospice nationwide, and do they have to go by, like we learned with Crystal, that not all hospitals have certain things and can allow certain things? Does hospice have that? Do they have the regulations? Like we have family in other parts of the country. Can they get the same care?
They do have hospice in other parts of the country, and there is a national hospice guidelines. Most of the hospices in this area and what you'll find in the United States are going according to the Medicare guidelines for hospice, regardless of if a patient has Medicare or not. And I know this is probably going to sound, trying not to sound insensitive, but that is the strictest criteria. And so if you meet that, you're going to meet everybody else's. And if you don't meet that, you don't get paid. So,
I got a question.
yes.
When you think of hospice, you think old.
Yes.
Do you see a lot of, does parents bring in a lot of kids? Do you see kids also?
Yeah. We see kids. We see babies. I've been, 7, almost 8 years. I have seen probably 30 or more, probably under the age of 10, go through hospice care. Yeah. Sometimes it's, babies that they know are not going to make it, but they just want to get them home. And I know this is probably going to sound weird, but I was not going to share the story, but I'm going to share it. I feel like, I don't even know how to explain this. I recently had a dog that passed away. She was 16. I had her for a long time, since she was a puppy. And it was this summer. And she had gotten sick. We didn't know what was wrong. We took her to the vet. They really didn't know what was wrong. And so they, scanned her. They did all this stuff, and just nobody really knew what was going on. So they gave her fluids, and they felt like she was getting a little bit better, and we were going into the weekend. And my Nala Bears hated being at the vet. And I just had this gut feeling that I needed to go get her. And so I went and got her, and she was not doing better. She was way worse than what she went in as. And all I wanted to do was to get her home. We got her home, we got her in her spot, and within 12 hours, she passed away. Now, I know you're thinking, well, that's a dog, and we're talking about human beings. It's the same mentality. Like, just getting people to where they want to be and getting them to who they want to be around, that will usually give them peace. That will give them peace. And I had peace of mind knowing that Nala, my mom, she's like, don't you let anybody tell you did the wrong thing, you did the right thing. Because people were like, you should have left her there so she could IVs. And I thought, if I would have left her there, she would have died in that cage with nobody around her. And I would have hated myself. I wouldn't have been able to live with that. And I just knew. And it's the same thing with family members. I know Crystal's probably seen it 100 times. They just, I want to go home. I want to go home. And you get them home, and within hours, they're gone. Because they just wanted to get home. That's all they wanted to do. And you have no idea how much they hear or how much they know. Because a lot of times when you're at the end of life, they're kind of in this, what we call minimally responsive stage, where they're not really talking, they look like they're sleeping, but you have no idea how much just hearing you can go, or we're going to be okay, or all of these things really helps people. They're gonna think, if they don't think I'm crazy, they're going to think I'm crazy now. I've had people wait till birthdays, till anniversaries. I've had people wait till that one grandson comes in from the Army, and literally within hours of him being in the house, the patient would pass away. Like, they know. And so with hospice, that's our goal. Whatever it is, we want to make that happen. And if it's, we recently got one on a guy whose his cancer has metastasized. He's still working, he's still doing things, and he's just like, I just want to live this last process the best way I can. So we're going to help him through that. You don't have to be bedridden to be in hospice. You don't have to be necessarily what we consider actively dying, within a 24-hour period of dying. You don't have to do that. You just have to be saying, listen, all the trips back and forth to the hospital, all the treatments, all the poking, all of this stuff, I'm done. I'm just ready to be at peace, spend time with my family, whatever it is you want to do, and we're going to help you do that. Was there a question? I'm sorry. Go ahead.
Oh, no, you're good. About the medical director, you said that every 30 days a hospice physician will reevaluate. Are they the ones that really provides the pain management, the medications, the orders? I know I'm like, oh my goodness. Do you see more of the medical director doing that than the personal physicians? Or is it a combination?
It's a combination, and it's not really a touchy subject, but I'm just trying not to get in trouble. Oh boy. There are certain physicians, every physician who gives us a referral, I ask them, are you willing to follow this patient through their hospice care? They can say yes and they can say no. Most oncologists will say yes. Most family physicians will say yes. Unfortunately, in this area, a lot of the problem we get into is a lot of doctors are very hesitant about pain medication anymore. Even if they love that patient, they'll be like, I'll manage everything except their pain medication, because they don't want to get into those type of scripts and things like that. So in the end, it is the patient's choice on who they want to follow their care. And if let's say that they choose Dr. Wagner, and Dr. Wagner says, I'm not going to follow their care. And if that's, then we automatically go to the medical director, and the medical director will do that. Now, if Dr. Wagner says, I am going to follow their care, and it's 2 o'clock in the morning, and I'm calling Dr. Wagner, and Dr. Wagner's not answering me, I'm going to call my medical director, because they're going to answer me, and they're going to get me the orders I need to get that patient comfortable. So, and when you go to the care center, you're automatically under the medical director there. Was there another question? Okay. All right, it's 7:55, and I'm just getting to the touchy stuff, so maybe we should end. Oh, boy. Busting hospice myths. All right, I'll give you time for questions, but I just want to say a few things. Oh, boy, I'm starting to sweat. So the number one thing I hear when consulting with patients and families, let me explain what I do, like exactly. I will get a phone call from the hospital or a text from Crystal, says, hey, we've got a patient for you. And me or one of the nurses that work in my office are going to go and we're going to talk to them. And we're going to say, here's where we're at. You know, they think that hospice would be beneficial to you. Here's what we can offer you. Here's what we think is best. They tell us what they want, and then we make peace with everything. Most of the time, here's the questions that I get. Are you going to give them morphine until they die? Are you going to give them the shot, which I haven't decided what that is yet? Are you going to feed them? Are you going to feed them, and are you going to take away all of their medications? So let me start by saying euthanasia and assisted suicide is illegal in every state in our area. So there is no hospice that is going to give you morphine until you die. Whatever that disease process is that that patient is dealing with is what kills them. It's not the morphine. And I'm going to explain morphine the best that I can. Morphine is a short-acting pain medication. And the reason a lot of hospices use it is because it does two things that really happen in the end of life. Number one, it controls pain. Number two, it controls shortness of breath. Now, the problem with morphine is because of the lifespan of how it works, you have to constantly increase it. If I give him 5 milligrams of morphine every 2 hours for a 48-hour period, eventually 5 milligrams is not going to be enough for him anymore. So we're going to have to go up to 10. And then we're going to have to go up to 15. And then we're going to have to go up to 20. Okay? So the problems with families is they just keep seeing that syringe get bigger and bigger and bigger, and you think that we're just overdosing patients, which, let me remind you, is illegal. Okay? So that's why morphine is used. Some people have heard it be called Roxanol. Some people use it under the tongue, in the mouth. Some people use it, on a sub-Q site or an IV site, and that's what we use. We also use Ativan. I don't know if you've ever heard of Ativan. We also use Haldol. We also use medications that help with those secretions. And we use all of those things because of all the symptoms that are going to happen as the body starts to shut down. I do not have enough time to go through everything that the body does to shut down. I really wanted to, but I can't. But morphine is used because it takes care of pain. It takes care of shortness of breath. It is a quick acting. If he is in pain right now, I could give him morphine and he would be out of pain within minutes. When you're going into the hospital and you're having a heart attack, does anybody know what the first thing they give you is? Morphine. Morphine. It relaxes you. It relaxes the muscles. It relaxes everything. So they're going to give you morphine. Morphine has a horrible reputation in hospice, and I know that. I know it does. But the reason why it's increased and the reason why they use it the way they use it is because it's fast acting and it's fast leaving. Okay? So you get it and it starts fast, but it also leaves fast. So that's why they have to keep increasing it. 90% of the time, regardless of whether a dying patient is medicated or not, they're not going to be responsive. Am I right? They're not going to be responsive. So when a family says to me, well, you're over-medicating, they're not responding, they're not going to respond anyways. But what's going to happen when you start taking that medication away is they're going to start to get restless, and you're going to start to see their feet moving, and you're going to start to see them picking at stuff, and you're going to start to see them moaning, and their facial expressions change because they're not comfortable. So around here, we like to talk, we like to eat. So when your loved one is laying there and they're not talking and they're not eating, you're thinking of all the things that are wrong. You need to take a big, deep breath and realize that that is where they need to be at that point in time. Because my favorite is when a family, I'm trying not to laugh, a family comes to me and says, you know, there's a thing called terminal agitation. What happens is your body and your mind are doing two different things, okay? Your body is shutting down and your mind is saying you want to live. And so they just become restless. They want to get out of the bed. We saw it with my grandpa Buford. They took him off life support, or the vent, and as he was transitioning, he kept on trying to get out of the bed. He wanted to go home. You know, their mind is saying one thing and their body is saying something else. So we give them Ativan or we give them Haldol to relax them so they'll be still. Well, you're over-medicating them because now they're not doing anything. Well, do you want them to be restless and trying to get out of the bed and fall, or would you like them to be medicated and laying there peaceful? Like, we got to think about these things. The hardest thing to do as a family member is realize that it's not about you. It's about them. And as I had to do everything but scream at my mother. I feel like, this is things that she has said, I feel like we starved her to death. I feel like we starved her to death. I'm like, Mom, you didn't starve her to death. If you would have fed her at that time, you would have killed her quicker. You know, she didn't want food. She didn't want water. She was fine, you know. And as difficult as dying is, and I know some people may think I'm crazy for saying this. You probably all think I'm crazy already. But as difficult as dying is, it can really be a good experience. It can be a peaceful experience. Is it horrible that you have to be without that loved one? Absolutely. Is it horrible that whatever disease process has taken their life? Sure. Does it leave a hole in your heart? Yes. But can you know that they didn't suffer? Can you know that they went peacefully? Can you know that you said everything you needed to say to them? Those are the good parts, and those are the things to remember. And that is what hospice is all about. Hospice is about compassionate end-of-life care, and whether that end of life is within hours or within months, we are there to do everything we can to help the family and the patient get through it. I think I'm done. Do I have to ask questions? Does anyone have anything I didn't answer? Yes, ma'am.
My question is, do the different hospice organizations have different services they provide? For example, like say one family, they've got certain medications that they have to have for the patient. Does hospice go get the medications that the doctor has ordered and bring them to the family at the house, yes or no?
Yes, except we don't go get them. We deliver them via FedEx. Hospice actually has a pharmacy. So anything that you are on, unless it's something that hospice does not provide, which is not a lot. I mean, it would have to be something really crazy, like Zometa is the first thing that comes to my mind that we don't provide for our patients. We provide all kinds of stuff, antidepressants, blood pressure medications, all of those things. We order them through our hospice pharmacia. They're covered under hospice benefit with whatever insurance that is, and they're delivered to the house via FedEx.
Okay, would that be the difference between how the personal physician wants to handle it? The reason I ask, when I was in Alabama with my father, they took care of everything. I didn't have to worry about going to the pharmacy and getting meds. Couldn't ask for a better experience in Alabama with hospice. In another family situation, like the wife was in the stages of passing, one of the family members had to go to the pharmacy and get the medications. That's why I was asking, because I saw the difference between the two states.
The only time that would happen is if they were either out of medication or they were starting something new that they needed now. Okay. And normally, if the hospice nurse is there, they will go and get that.
Well, I do realize when they brought her home from the hospital, they didn't get the bed until 3 days later. So I was just curious.
Hospital's fault.
I don't know where the ball got dropped, but I know she got home Friday evening late, which that was the hospital's fault. But she didn't actually get that hospital bed, until Monday.
Yeah, because she got home on a Friday. It should have been there before she got home.
Exactly, that's the way they did with Daddy. Everything was set in motion, it was set in place, and I didn't have to worry about a thing.
That's almost always our fault. It is. Well, no, it is. And fortunately, the hospice that Holly works for is fantastic. They are super efficient. They get everything done. Now, there are times like if we discharge people on like a Saturday, we will fill scripts for 3 days or something until hospice can kind of take that over. But that is usually the facility's fault.
Thank you for saying that, Crystal. Well, it does happen, and it's not just the hospital that she works for, but it happens frequently. We have patients get home. I remember we had a patient a few weeks ago that was coming home from Ohio State, and the social worker I had been talking to and getting all the records from told me that they didn't need anything. They didn't need any equipment. Well, this guy was on 5 liters of oxygen, and so we had an ambulance sitting there saying, we're not leaving this patient here until there's oxygen here, and if it doesn't get here within 20 minutes, we're taking him to the ER. And I'm like, so it happens, things fall through, but obviously we try. I will get equipment in the house. If I know a patient's going home on Friday or Saturday, I'll get equipment in the house today, period. It'll be there. Call me next time.
Quick question. Hopefully it won't be next time. I know that like our office that I work for, once every 3 months, we do a dinner and take it to the hospice house for patients, families, and all that. Do you all accept that, and do you do that?
Yeah.
So we just need to sign up if we want to do that? How does that work?
Yeah, just call it's called Ashland. It's called Community Hospice Care Center. I can't think about it. But yes, you would just call them and let them know, and whenever you would want to bring it, there's a family room there and big dining room and all that stuff.
I didn't hear the answer about checking the knees.
Oh, that's because I didn't get into the dying process because we don't have time.
Okay, we'll get it.
Quickly. One of the first things that happen is their hands and their legs, their hands and their feet will start to get cold and they will start to turn colors. And the reason that is when the body is what we consider the actively dying stage, all of the blood that is in places that we don't need, it all goes to your center. And it goes to all of your vital organs. So we start to check the feet. Have you guys heard the word mottled? No? So when the feet look gray or purple, we call that mottling. And so we look at the knees and we look at the feet. And once we realize that's starting to happen, we realize the body is starting to shut down. We're looking at probably 72 hours or less at that point. No. 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 Oh, my goodness. Thank you guys for listening. And if you ever have any questions, let me know.
Hey, good job, Holly. Thanks, Dad. I used to be a volunteer dancer at the care center. I started pastoring after that. I couldn't hear it. There's not another church in this area or in this country probably that you could go to and get this kind of conversation. Just a couple things, and then we need to move these chairs. We do the little tweetable moment. You see it on the Facebook or on Instagram. And this week it says, what you fear controls you. But really the first one I sent to Tyler was, some call it the afterlife, but it should be called the better life. I pulled that back because of how some people might interpret that with people wanting to hurt themselves and the different people that have acted on that lately. And I thought that's probably not a good thing to, but really the truth, that is the truth. It's not the afterlife, it's the better life. And somebody sent me a message, it was an incredible message, but when I used the illustration about falling asleep in the car and then waking up in your bed, that's kind of how it is with death. Jesus is just there to carry you. And so I think the more we talk about it, the more we have the conversation, the better that we can really handle that kind of situation. So I wanted to mention those couple of things. The last thing I'll mention is at the very beginning, she had that slide that had Jonelle, my mother-in-law, and she said my why. Let me just explain real quickly what that, with the leadership here at Tri-State Worship Center for the last several years, it's been all about the why. We know what we do, right? We teach lessons, we sing songs, we do sermons. We know what to do, but why do we do it? And if we know our why, the what becomes very powerful. If we lose sight of the why, we're just going through routines. We're not really doing it. That's like the teacher who comes to me, the children's teacher that comes and says, I'm burnt out. No, you've lost sight of the why. How can you be burnt out from teaching little kids about Jesus? I mean, how can you be burnt out from that? So we got to know the why. Her why to get to hospice was to go through that process with my mother-in-law and to see how hospice was there. So not only the leadership at Tri-State Worship Center, but we all need to know the why. Why do we do? We know what to do, but why do we do it? I think that would be the difference. Let's stand. Don't forget, blood drive Saturday. If you're not signed up, see Carolyn. You have a meeting tonight for all the parents of Winterfest, or that's Sunday morning after church. Bye, Holly. Yeah, Mo. That's what I call her, Mo. So help me with the chairs. Get them on the other side of the 3 at a time, or carry 4, or wheel 10. But don't drag more than 3. You drag more than 3, I will kill you. Just these 2 sections, what Carolyn said, right? Right. Thank you, Lord, for tonight. Thank you for equipping our church with people that are knowledgeable, that can share information with us to help us. Thank you for Holly, for Crystal, God, for those that will be sharing in the next couple of weeks. I just thank you that you've gifted them the way that you have. Pray that the information that we share just helps us not to look at the afterlife, but to be ready for the better life. And so I just pray that you'll help us with that. I pray that as we leave this place in a few moments, you'll keep us safe. God, in all we do, we love you. We thank you for that in Christ's name. Someone say amen. Let's move these chairs.